NHS outpatient hospital visits have nearly doubled in the last decade. They account for over 85% of non-emergency hospital activity, or 118 million consultations a year in England. And then on top of that, there's a 20% cancellation or failure to attend rate. We also know that 5% of all road traffic in England is caused by the NHS alone. This all results in a huge cost and burden to not only the NHS, but the environment as well. This model is outdated and unsustainable. Healthcare professionals agree that many patients don't always require traditional face-to-face outpatient care. So the NHS long-term plan has set a goal to avoid up to a third of these face-to-face appointments over the next 5 years. It encourages developing new models of care with non-face-to-face appointments as one of the potential solutions. To help anyone looking to set up a non-face-to-face clinic, we've put together a resource with useful tools, videos, animations and checklists. We define what non-face-to-face clinics actually are, presenting different models, and cover topics from working with commissioners, leadership and governance, to IT, communication with patients and evaluation. This section looks at how developing good relationships with your local commissioners is crucial in the planning of non-face-to-face clinics. You'll be working together to ensure you're addressing the local population's needs and priorities, as well as discussing and agreeing options for sustainable long-term commissioning. In this section, you'll hear from commissioners and providers on their experiences of working together. Effective leadership is an important element of any transition. It can ensure the success of adoption and spread of new, innovative ways of working. So in this section, we highlight the role leadership plays in developing a non-face-to-face clinic, signposting to a range of useful leadership resources. The consideration of issues around governance and information governance are important in planning the non-face-to-face clinics. For example, within the model you decide on, you'll need to think about who the responsibility for the patient will lie with, and how this will affect your liability as an individual and a team. You'll need to think about how to get patient consent, sharing patients' data, and maintaining patient confidentiality. To help with all of this, we've created a checklist to support you in your considerations of these issues. At all stages of the transition towards working with non-face-to-face clinics, we must ensure our patients are involved. Once established, care must be taken to ensure patients understand what these changes will mean for them. We must continue to communicate with care and compassion about their treatment and management, and also seek to understand how they wish to be engaged, as this may differ from model to model. We cover ways to gain this understanding with your patients and communication considerations. Different non-face-to-face clinics will have different IT and system requirements. So when considering what IT equipment you might require and what IT support you might need, we've created a checklist of questions for you to consider. You'll also hear from colleagues about their experiences of setting up IT systems and how they overcame some of the challenges they faced. Finally, to help inform whether these new alternative models are successful compared to traditional outpatient clinics, we must consider the impact they have. For example, what effect do these clinics have on waiting times for consultations? How do patient outcomes compare between the two models? And how are these clinics perceived by both patients and staff? This section will get you to consider the quantitative and qualitative data that can support you in evaluating your new model of care. This is just a brief overview of the resources we've put together to help you in setting up your non-face-to-face clinic. So we invite you to explore them further. You can run through them from start to finish, or focus on the sections most relevant to you. We hope they help you towards meeting the NHS long-term plan goals across your local area.